Namaskar, hello and welcome to Sunset TV. I'm Tina Jha. You're watching Perspective, the show where we discuss and analyze issues pertinent to India and the world. Today we are going to talk about India's population growth. Now, according to the National Family Health Survey data for 2019-2021, the country's population is set to fall as its total fertility rate, which is the average number of children born to a woman over her lifetime, has dropped to 2 for the first time ever. In the 2015-16 survey, the national TFR was 2.2, and before that, in the 2005-6 survey, it was 2.7. Now it has dropped down to 2, which is below replacement level. The replacement level of TFR, at which a population exactly replaces itself from one generation to the next one, is estimated to be 2.1. The findings suggest that TFR has declined to 2.1 in rural areas and 1.6 in the urban areas. So on the show today, we will analyze the key findings of the latest NFHS survey, what it means for India, the challenges before the country as TFR falls, and the way forward. To discuss these and related aspects, I have with me a distinguished set of panel. So let me first introduce them to you. Joining me in the studio is Poonam Mutreja. She's Executive Director, Population Foundation of India. And joining us virtually are two eminent panelists as well, Dr. S.K. Singh. He's Professor and Head, Department of Mathematical Demography and Statistics, International Institute for Population Sciences. And Dr. J.K. Bajaj, Director, Center for Policy Studies. Thank you to all my guests for joining me on the program today. Dr. Singh, so since IIPS was the nodal agency that conducted the latest survey, let me begin the program with your first comments on what a declining TFR means for India. Is it an indication that the population of India is now stabilizing?
Yes. In this Amrit Mahotsav, when the country is celebrating Amrit Mahotsav in the current year, this is a really great news for the country. That after 74 years of independence, we have entered in the stage where population has already achieved replacement level. But reaching replacement level fertility does not mean population stabilization. You have rightly explained that a couple having TFR of 2.0 means a woman during her entire lifetime, she is producing 2 children. That leads towards population stabilization, subsequently after accounting for population momentum. We anticipate that around 30 to 35 years time will be required for population stabilization, from where population will start declining if we are able to maintain this. How it has happened is most important. When we released the NFHS 4 result in 15-16, it was noticed that contraceptive prevalence was almost stagnant for a decade from 2005-6 to 15-16. After that, Government of India has started Mission Parivar Vikas. During last 5 years, there has been tremendous progress in efficiency and effectiveness of our family planning program, which has resulted into increase from 53% to 67%, which is almost optimum for any country with the given demographic models to achieve the replacement level fertility. India has been able to. Now, question is to sustain it.
Absolutely.
Only 3 major states, that's Bihar with 3.0, UP with 2.4, and Jharkhand with 2.3. These are the 3 states where we are having slightly above replacement level fertility, and 2 smaller states, Meghalaya 2.9 and Manipur 2.2. Altogether, only 5 states is having this.
Certainly. So how we are going to sustain it? What are the challenges? I'll come back to you and understand all of that. And let me take the comments also from Poonam Mutreja and try and understand from the 1950s when India had a TFR of around 6 to now in 2020, we have brought it down to 2. And what's remarkable is that we have managed to do it without any coercive measure, unlike China, which also had a TFR of 6 in the 1950s. But all of us know it brought about a one-child norm, which it implemented for quite a number of decades. So how do you look at it, what it means for our population growth?
So for India to do it without coercion is a great achievement. Let's first recognize that. And especially when we compare ourselves to China and the country is worried we are going to overtake China. We are going to overtake China with dignity, with freedom and without coercion. So that's something to celebrate too, along with the fact that we've reached replacement level. Second, I'd like to say that it is an achievement for women of India that they not only decided they want not more than 2 children, but they are managing to exercise their rights in spite of a very patriarchal framework and family planning not being totally accessible. I agree with Professor Singh that some efforts have been made thanks to Mission Parivar, but that's only in 140 districts, but rightly so in high fertility districts. Second, I'd like to say that, you know, the media has played a big role in exposing the poor and the other half to the fact on how the better half lives, with fewer children, investing in their education, investing in women's health, women also practicing the number of desired fertility, which is less than 2 in India and has been for some time. So the other half knows how the better half lives, and they've decided they want fewer children, they want to invest in their education. And finally, I don't think we recognize the role that inflation, food inflation has played. You know, 90% of the expenditures of Indians is on food, especially the poor, and they cannot afford to feed more than 2 people. Yes. And finally, I'd like to say that India investing in more methods definitely has helped, and there has been some behavior change, communication, which the government has done, other organizations have done, and PFI, where I work, has played a big role in our serial Main Kuch Bhi Kar Sakti Hoon, which focuses on family planning and reached the media dark areas. And there are others who have done in Bihar, especially, you know, Bihar, UP, I've seen a lot of behavior change, communication and changing social norms. So India has arrived at the possibility of people exercising their not just rights, but their aspirations have changed. And this is the new India with different aspirations.
Absolutely. So,
and we've come a long way, and it is something to celebrate.
So a big demographic landmark that Poonam Mutreja is saying, Dr. Bajaj. So in this, obviously, what both our guests have been saying, there have been coordinated efforts from different agencies. So if we look at, obviously, the population control measures by the government, India has been the first country in the world which launched the National Family Planning Program back in 1952. Consistent efforts have been made and they've been sustained as well through the decades. What kind of a role has the National Family Planning Program played in bringing us to this demographic landmark that we are talking about today?
Tina, it is indeed a great landmark that we have achieved. And in achieving this kind of landmarks in a society, in a large nation like India, the state, of course, has a major role. But ultimately, it's the people of India, both the women and the men, who have moved in a certain direction, who have developed, have got more educated, have seen things, better access to things, which has led us to this landmark. And I should emphasize that we were moving towards this landmark for several years now. Yes. Last year, I think 2020 July, there was a analysis in the Lancet which predicted that by 2017, given the trends, India would reach replacement levels of fertility. And of course, many other nations it was suggesting. So this is something which was on the cards. In fact, it has been the cards since 1950, because if you look at the growth rates of population, our population, decadal population growth rate started coming down by the third decade of independence, from 81, 91. From decade to decade, our growth rates have been declining, and considerably declining. So this is a process that has gone on from the 50s till today. Mm-hmm. And this is a very positive process. We needed a certain level of growth in the population after the colonial phase passed. And now that we have reached a certain level, we have started moving towards stabilizing the population. I want to make one more point before we come to other issues. 2.1 is said to be the replacement rate, which means that for every father and every mother, there's a child. There's a child for the father, there's a child for the mother.
Yes.
And you add 0.1 for wastage, children who die early.
Yes.
So 2.1 is the replacement rate in societies where infant mortality, under 5 mortality is low or reasonably low. In India, under 5 mortality is coming down, but is still fairly high.
There, yes.
And for a society at this level of under 5 mortality, replacement rate would have been reached when we reached 2.2. So we should remember that we are passing through a process, and every aspect of demography has to be looked into. And our next target should be, having achieved this, that let us drastically lower the neonatal death rates, neonatal mortality, infant mortality, under 5 mortality, so that in those numbers also we should start looking like a country that has arrived.
Certainly.
We'll certainly do it. Maybe it's a matter of another 5 years.
Absolutely.
We'll do it. I think that should be our next target.
Professor Singh, so now that we have achieved this landmark, the big challenge that you mentioned earlier was now to sustain it. The question that I want to ask you is, how low can the TFR in any country go to until it becomes a cause of concern? And this is one problem we have seen in countries like Europe, where they are now struggling with this rapid decline in TFR.
Thank you, Tina. Thanks for this raising very important question. Even if you look at our NFHS 5 results, state like Tamil Nadu and Kerala, where TFR in NFHS 4 was 1.6, there is a marginal increase from 1.6 to 1.8. That is why anything below 1.6 is slightly problematic to maintain or to sustain for a longer period. That is primarily because of population momentum. Many European countries have also seen, but our challenges are different. For example, the most important challenge is, in one hand, we are celebrating the achievement, this achievement of TFR 2.0. At the same time, the teenage motherhood, adolescent motherhood is a real challenge for our country.
Yes.
Okay, and particularly 7 states, those, especially let me talk about 5 states first. That's Assam, Tripura, West Bengal, Bihar, and Jharkhand. These are the 5 states where age at marriage is very low. Our program is able to contain the growth by focus at female sterilization. But for these younger women who are marrying before minimum legal age at marriage of 18 years, we are not able to promote a spacing method of contraception. That is why we are not able to delay their first pregnancy, resulting into resulting into teenage motherhood, adolescent fertility, which Dr. Bajaj was mentioning is one of the prime cause for maternal and child mortality. Early childhood mortality also key drivers, and maternal mortality ratio also key driver. Of course, on maternal health, Tina ji, it is extremely important that India has made such a tremendous progress that we are estimating, we are projecting with the help of various artificial intelligence techniques that India may achieve SDG goal for maternal and child health well before 2030. But with increasing institutional births, C-section is another challenge. Increasing proportion of C-section deliveries, especially in private health facility, is beyond any medical explanation in our country. That's one of another prime concern. Not only
since
teenage
he's talking
motherhood
about
and
women's
age at marriage.
health in our country, and which of course is a cause of concern, One finding that particularly caught my attention was that the burden of contraception, and that the survey suggests, is still lies majorly on women. How concerning is that? What needs to be done to ensure that the burden of contraception is shared equally among men and women?
So that's why in the beginning I said it's an achievement for women. This fertility rate going to 2, because our men are not participating in taking responsibility for family planning. It is primarily women. If you look at sterilization, it's less than 0.5 for men in India. In fact, it's gone down to 0.3, while women go through, 75% of the women go through, not only use different contraceptives, but sterilization. The burden entirely falls on women. In fact, there are the surveys show that men consider it women's responsibility for family planning. So I joke sometimes that women live with the fear of getting pregnant when they don't want to get pregnant, when they have sex, or end up basically sex is for reproduction, while for men it's just pleasure. And they do not use contraceptives like condoms and go through vasectomy because they feel their libido, their pleasure will be affected. What about women? So I think we need, going forward, while we absolutely, I agree with Dr. Bajaj and Professor Singh, we need to focus on reducing maternal mortality, child mortality. But the biggest thing we need to do is put the burden and make not the burden, but the responsibility
yes,
of family planning on men. Men have to step up in this country. It is too patriarchal a society where the women not only have the privilege, yes, of being able to deliver, which men don't have, of babies, but men neither take responsibility for contraception and nor for childcare. I think these are things going forward, especially if we want to avoid what you were discussing with Dr. Singh, minus growth rates like Europe. We need women-friendly equality. We need women-friendly policies, not just in family planning, but we need to change mindsets of men.
Behavioral changes have to be
workplace.
There, yes.
We need to give women opportunities to be able to work and reduce their caregiving role. Women's caregiving role, as we saw even during COVID, has exponentially increased, and women are being forced to step out of the workforce. And I always say the biggest impediment is a caregiving role of women. And finally, I also want to say in that context that education is the best pill. And education, putting women in not just primary school, high school, college education, not only will it empower families, but that's the best family planning contraceptive. There is nothing, and I think nothing better than that. And I think the fact we've reached to where we've reached is also because more women are getting educated.
Okay.
We know that globally, if women do class 12, they are likely to have less than 2 or 2 children. But if they have less education, they are likely to have more children. So we need to do many things, and this is a good time for India to invest in women, but men need to invest in being more responsible.
And take up more responsibility. Absolutely. Dr. Bajaj, Poonamji made a very valid point that development is the best contraception. For long, what we have seen is our policymakers and a number of experts keep saying that our population size is the biggest hurdle, biggest roadblock when we talk about the country's development. Now, with the TFR declining, and in the coming 35 to 40 years, our population finally declining, do you think population will no longer be the hindrance towards development that is often talked about?
As far as I think, population should never be seen as a hindrance. It should be seen as a resource. And certainly now that we have reached at the level of 2.0 replacement level, all the population that we have today, each person, each woman, each man is an asset for the country. None of them should be seen as a liability. It is our duty. Development means that every person born becomes an asset for the nation.
Yes.
But Tina, I want to raise one more issue in this context, which is significant. India, of course, has achieved this fertility rate TFR of replacement level as a whole. But India is not a single population. There we have groups within India. And there are several issues of concern which need to be highlighted. One of the major issues of concern is that if you look at the NHS 4, the TFR, it gives you the TFR of Hindus, Sikhs, and Jains, Buddhists, and Muslims. Already in NHFS 4, Hindus, Sikhs, Jains, Buddhists were all below 2.1. It was Muslims were at 2.6. Mm-hmm. Now this gap you see, recently Pew did a major study on Indian religious demography. And one of the things they pointed out was that you control for all parameters, control for education, control for wealth, household wealth, control for urban, rural, control for age, and you still end up with a difference of about 30% in the fertility of Muslims and the Hindus. Now, that difference, now that we are going to become a shrinking population, Lancet's estimate is that by the end of the century, we will be 30 crores short of what we are today. Our population, instead of 1.3 crore, 130 crores, will be 100 crores.
Yes.
Now, if the process of this differential fertility remains, then the ratio of different communities in that 100 crores can be very different than what we have today. And that should be a matter which needs to be flagged. In fact, the Lancet study also shows that while Indian population will decline by 30 crores compared to what it is today, the population of Pakistan will increase by 3 crores in the same period from here.
Professor Singh will be able to shed light on it, that the levels of literacy define the TFR in more concrete terms as compared to religion.
Exactly.
I also have this opinion that if you look at the religious differences, most important factor is education.
Yes.
Most important factor is poverty. Even if you look at NFHS 4 or NFHS 5 figures, the differential between illiterate and those who are 12 or more years of schooling, differential between those who are lowest wealth quintile and those who are in the highest wealth quintile, those differentials are more pronounced than religious differentials. Hindu-Muslim, both fertility is declining. This is another thing that in some states, pace of decline may be different, rate of decline may be slightly different. Otherwise, there is absolutely no point of making.
Absolutely, and these are sustained efforts that we've been talking about, Poonamji. That it's education, independence to women, the literacy levels rising in different states. These are factors which have played prominent roles in bringing us to this landmark numbers that we are talking about today, isn't it?
You know, this whole issue of raising the Muslim, it's almost like a fear psychosis that has been created in India, which the Muslim growth rate is much higher than Hindus and they will overtake or their numbers will be huge. This has done a lot of damage in India, and I think we have to stop and look at the data as Dr. Singh.
So time is running out. I'll have to call it a wrap on this edition of Perspective. Thank you, Dr. Bajaj, Professor Singh and Poonamji for joining me on the program today and sharing your perspective with us and our viewers. So that's it from us on Perspective today. Thanks very much for your time. See you again next time. Bye-bye.